Oncogenic Microbe Helicobacter pylori. H. pylori is a bacterium that infects the stomach lining. Long-term infection causes gastric adenocarcinoma, a type of stomach cancer, malt lymphoma, a cancer of the mucosa-associated lymphoid tissue. The cancer risk comes from chronic inflammation and the development of atrophic gastritis. USMLE Style Question 1. A 60-year-old man presents with weight loss, early satiety, and epigastric pain. Endoscopy reveals an ulcerated gastric mass. Biopsy confirms adenocarcinoma. Which of the following infections is most likely involved in this condition? A. Epstein-Barr virus. B. Hepatitis C virus. C. Helicobacter pylori. D. Human papillomavirus. E. Cytomegalovirus. Correct answer C. Helicobacter pylori. Explanation: H. pylori is a major cause of gastric adenocarcinoma, especially in patients with chronic gastritis and atrophic changes. Why not the others? A. EBV can be linked to some gastric cancers, but is more associated with lymphomas. B. HCV causes liver, not gastric cancer. D. HPV is linked to cervical, anal, and oropharyngeal cancers. ECMV is not oncogenic. USMLE Style Question 2. A 55-year-old woman with a history of chronic gastritis is found to have a low-grade lymphoma in the stomach wall. Biopsy suggests malt lymphoma. Which of the following is the best next step in management? A. Start chemotherapy. B. Begin corticosteroid therapy. C. Surgical removal of the tumor. D. Eradicate H. pylori infection. E. Radiation therapy. Correct answer, D. Eradicate H. pylori infection. Exolymphoma is often driven by H. pylori infection and can regress completely with antibiotic eradication therapy. Why not the others? A. Chemotherapy is reserved for non-responders or advanced disease. B. Corticosteroids are not first line. C. Surgery is not necessary if infection is treated. E. Radiation is used only if antibiotics fail.